Hi, welcome back to the channel. Hope you're doing well today. The theme for the video today is transgender as it relates to hair loss and hair restoration surgery. We have a lot of patients who come to us for help during their transition period from male to female, female to male transgender. Of course, that involves a lot of medical therapy, hormone replacement, and everything like that. It requires a lot of commitment in terms of the patient. So I really admire the people that are going through these transitions. They're not easy from a psychological standpoint, from a social standpoint. So we sympathize with them greatly, and I personally admire their courage. So we are here to offer help. Sometimes a male going into a female, what they have to deal with is they have a male pattern hair loss, or they have a hairline that's a more masculine, and they want to make that hairline more feminine so they can go with their new look or their new their personality now. So we get a lot of patients coming to us now for that. It's called the hairline feminization surgery. So we're going to talk a little bit about that. It requires expertise on the part of the surgeon and the team. It requires a lot of care. It requires a lot of knowledge on technique and hairline placement. The male hairline and the female hairline have certain differences, and you want to provide these patients with as feminine as possible of a hairline so they don't have to rely on wigs or hair pieces all the time. So I have a lot of experience with those patients. Also, patients that are coming from female to a male, they take the male hormones, the testosterone, the androgenetic hormones. A lot of times they'll start growing some facial hair after they do that for a while. They get some body hair on their legs, on their chest. But usually, they can be thin, they can be sparse, and invariably they would want to have a little bit more of a masculine face with a little bit of facial hair if they choose to. So we do a fair amount of transplants for female to male transgender patients on the facial hair, putting hair in the beard, reconstructing beards, strengthening what they could grow after their hormones. So I'm going to show you a couple of cases here. Actually, one example, her testimonial is in our website, so I will link the channel, the video to you here at the end of this video, so you can watch her whole history. She counts her journey, and it's very inspiring. So we are thankful for her for putting that up. As far as beards in transgenders, I don't have a lot of pictures to show because obviously these patients are very private. They don't like their face particularly exposed, and so I don't have any beard results to show you. But on the video about beards, you will get a sense of what we can do with facial hair, and it's pretty much the same thing. It translates pretty well to the transgender patient as well. So let me go ahead and show you an example here of what we're able to do to patients, and see you in a little bit. So I want to share with you the case of a patient. Her name is Ronnie. She came to us a few years ago asking for the possibility of us working on her hair. She was going through the hormone therapy from a male to female transition. She had started with the female hormones, knocking down the androgen hormones, so she was going through that physical, psychological transformation. But she had to resort to a wig because she had some male pattern baldness that was already fairly advanced by the time she got to us. So in consultation with her, we went over everything, her long-term goals, how much hair I could give her based on the amount that she lost. And at the end of the consultation, both she and I felt pretty good that we could achieve something that would make her happy. It would allow her not to wear the wigs all the time. And so we proceeded with the transplant. One thing that was very critical for Ronnie, and it is for most patients facing that transition, is that her hairline became more feminine looking. If you look at a male hairline, normally you're going to encounter a little bit of recession. The corners here, the temporal corners, are usually further back, and so that's what normally is sort of a mature male hairline looks like. Now, if you start looking at female hairlines, you'll see that they don't have normally that deep corner. Their hairline is much softer. It's more of a rounded shape to it. The hairs tend to behave in a different way. they don't have so much as what we call temporal points, which are these sharp edges here. Theirs is much softer. And so all of these parameters you have to take into account so that you don't just do a hairline on Ronnie that would look thicker but masculine looking. That's not going to solve her problem because it's still going to look like a man. So what you want to do for her, you want to go ahead and round her hairline to give her more of a female shape. Coincidentally, she did have already kind of a little bit of a more rounded hairline here. Probably the hormone replacement that she started doing a few years back has helped maintain these. But if for a regular man, we would cut these corners here, we would not work too much on these temporal corners because, again, a male hairline requires more receding. Now this is her after 3 procedures. So this is her. So at this time she was wearing a wig all the time. She would not go anywhere without the wig. The back of her head was also pretty thin, not completely bald, but it was kind of thin throughout, very transparent. She did have a good amount of hair on the back and sides of her head, what we call the donor hair. Those hairs are permanent. Those are the ones we use with the transplant. So the first procedure that we did for her, the main thing was to reestablish the naturalness of the hairline. So that round contour here, you see how her hair can drape over the sides here really well. So her hair drapes over the sides here really well. If the hairline was more receded here, like the male, she wouldn't be able to get the hair to drape as low as it goes. You can see how it flows naturally. Some of the transplants have already achieved a nice length here. So then we did a second procedure for her to go in the same areas just to get more density, so she wouldn't see as much scalp, and also put a little bit of hair into the crown. And then finally we did a third surgery for her to then give her some support in the crown here, still thin looking but much better. With this sort of hairstyle brush to the side or back, she can hide that really well, and she has not worn a wig for a while now. So this was the day that she recorded the testimonial that you have on our YouTube channel. Again, I'll put a link here in the video so you can go and watch there. I think you'll be moved by her words, and I think it'll resonate to a lot of people that are facing the same situation. So this is what's achievable if that's what you're looking for, to help you in your transition, to help you in the new life that you're going through now. And so if we can be of help, it is my honor, and I'm here to help you out. So as you see, we're able to produce very natural, very nice results for our transgender patients, whether you're coming from male to female or female to male. There are options, and there are very good options that are very cosmetically pleasing as far as hair goes and as far as beard hair goes too. So talk to us. We can do a free consultation for you. We can evaluate your situation and give you an idea of what can be done and some recommendations also. Feel free to call us. You'll be treated with the utmost respect. As I said, personally, I have a lot of admiration for what a person goes through during that time in their life, and we have a lot of support system here in the office. You'll feel right at home. If you want to give us a chance to help you, the phone number to call is right about down here. Please like the video, subscribe to it so other people in your situation can also benefit from these treatments. Okay? Thank you.